As said by Maya Angelou in 2014, as a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. Being a nurse aide has many opportunities. We help the nurses with whatever they may ask, such as taking blood sugars, helping stock rooms, and bathing and turning patients as needed. As said by Paula Melin, a CCRN in the ICU in 2014, a nurse aide position in the ICU is critical because without them helping with the patients or stocking the rooms, it would make the nurses' jobs much more difficult. The reason I chose to speak about the ICU is because I recently received a job at the St. Alexis Hospital in Bismarck, North Dakota. Since the ICU takes in patients with the most critical of conditions, it is important that the nurse aide and the staff are prepared. The new patients coming in could be a friend you know, a family member, or even yourself, making it important for us to talk first about the ICU in general, second, the nurse aides, and third, the kinds of characteristics needed to be a nurse aide. As said in an article called About Critical Care Nursing in 2014, critical care nursing is a specialty within nursing that deals specifically with human responses to life-threatening problems. A critical care nurse is a licensed professional nurse who is responsible for ensuring that accurately and critically ill patients and their families received optimal care. There are many kinds of patients that we get in the ICU. We mostly get trauma patients and heart and stroke patients. The trauma patients we either get by ground or through helicopter, and it is my job to make sure I get the bed and the air ready to bring up to the helipad to bring them to the emergency room. I also have to take blood sugars for the patients, usually every 3 hours or sometimes hourly, whenever the nurse asks me to take them. I go into the room and make sure they know who I am and what I'm going to be doing, and then I make sure I tell the nurse what number I got for their AccuCheck. I also stock the rooms every shift to make sure that the nurses and doctors have the required materials they need for their job. I also answer the phone and take messages for the nurses and doctors and do some paperwork for the patients, such as admitting and discharging patients. Some characteristics that you need to be a nurse or a nurse aide in the ICU is that you need to be very helpful and caring, patient, compassionate, and strong. In summary, today I explained what the ICU is in general, kinds of patients the ICU takes, and responsibilities of the nurse aide. Thank you for listening.
Cool.
Thank you.
Yay!